Hello and welcome back to another edition of the Fit Physician podcast. In today's episode, we are back with another science snack. A science snack is where we review a study, talk about its methods, its outcomes, and any take-home messages from that. So in today's episode, we are going to be reviewing the LIFTMOR study, which was done by Stephen Watson et al. Suzanne is going to be the one who's going to help us break it all down. Thank you so much for joining us, Suzanne.
Yeah, happy to be here. I love these science snacks. They're my favorite.
And so let's talk about, first and foremost, what made you interested in this particular study? What's it all about?
Yeah, when I came across this study, it intrigued me for multiple reasons. Obviously, anything to do in bone protection, any studies that look at osteoporosis prevention or treatment is obviously something that is in my wheelhouse, being a primary care practitioner, also being a midlife woman myself, who's really invested in protecting my own bone mineral density and bone health. These things really do interest me. And what really caught my eye with this one was that the study is actually looking at whether or not women with pre-existing low bone mineral density, whether it is safe and effective for them to do heavy resistance training and impact exercises. Because traditionally speaking, back when I was starting my practice, it was actually, we were discouraging patients who had low bone mineral density from doing really heavy resistance training or high impact training because we were worried that they might fracture because of their low bone density. So it was interesting to me when this study came across my eyes, essentially, because I was curious to know whether or not it supported underlying belief or whether or not it actually, these women would benefit from it. And so that's what this study dug into.
Cool. And so let's talk about the type of study and how they went about their findings.
Yeah. So the study was done, it is a randomized control trial. So the study broke 101 women into two groups. I think it was like 49 and 51 were the two cohorts. All of the women had pre-existing low bone mineral density. So what that means is their T-score, for those of you that are practitioners or clinicians listening, they had to have a T-score of less than 1. So these women were already, like I said, osteopenic or osteoporotic. They were all on average. The average age was 65. So I can't remember exactly the youngest or the oldest, but the average age of the women was 65 years old. So we're looking at mainly postmenopausal women with low bone mineral density. So they divided the women into two groups. One group, which was the intervention group, was the women were given resistance training workouts to do under supervision. And I'm going to keep honing in on this. These were under supervision, so done with the close supervision of qualified personal trainers. So they were put into a resistance training program where it was quite heavy resistance. So heavy weights. They were doing, a combination of barbell, back squats, deadlifts, overhead presses. So a lot of barbell work. So heavy stuff around the 5 rep range. So doing 5 reps for each set. So again, heavier, really pushing towards that 85% plus of their maximum rep range. The other group were just left to do their own unsupervised at-home light resistance workouts. And those I can only imagine were a variety of things because they weren't set out as specific workouts. Again, can only presume they were more like body weight, lower resistance types workouts, just more gentle resistance training in their home environment, unsupervised. So that was the control group. The intervention group, like I said, there were 2 sessions per week of higher resistance training. So what they did is they divided the women and they followed them over the course of 8 months, testing their bone mineral density before and after 8 months of their intervention. They also looked at things like overall strength, the get up and go tests, balance, like different functional measures as well, not just bone mineral density in both groups. And the findings were actually quite impressive. So in the resistance training, the heavy resistance training. And I should also mention, it wasn't just resistance training alone. It also included some high impact activity, again, under supervision. So things like hanging from a chin-up bar and then just letting themselves fall to the ground with safe impact, absorbing, that force through the knees, but impact to the ground, those sort of high impact. So it was the combination of heavy resistance training and the high impact exercise. And in that group, after 8 months, they found significant changes in their bone mineral density. In the spine itself, there was a 3% increase in the BMD, significant changes. And alternatively, in the group that was just doing the lighter resistance training, home-based exercises, they actually found further additional bone mineral density loss. So really substantial. One improved and one continued to lose. On top of that, they actually, and no surprise, found when it came to all the functional parameters, so we're talking overall strength, balance, the get up and go tests, they all improved in the higher resistance training group, the heavier resistance training group, I should say. So again, clearly women with low bone mineral density had something to gain, quite literally, from doing higher, heavier lifting. On top of that, because this was the really other important question they wanted to ask, were they at increased risk of fractures or injuries? And there was actually only one injury noted in the high, heavier resistance training group, and that was a back spasm in one of the women. There was no increased risks of fractures. In fact, no fractures documented at all in that intervention group, which was really, really interesting because that's what we were always most fearful of when it came to women with osteopenia or osteoporosis, that they might be at increased risk of having fractures. Now, bear in mind, this is only 101 women. Like we haven't, it's not a huge amount, but it does give us, some peace of mind that women with low bone mineral density can still lift heavy and possibly benefit from lifting heavy and high impact exercises if closely supervised and done in a safe, managed way.
Yeah, very cool. And I'd love to dive into more about that. Before we do, were there any limitations to the study?
Like I said, small study, only 8 months. And all we really are measuring at this point is actual bone mineral density. So we don't know how that correlates to fracture risk or not. And that's really what matters, right? A bone mineral density is a simple measurement, but what matters is whether or not this higher resistance training, stronger loads, which led to higher bone mineral density, does it actually lead to less fractures, right? And we don't have that information. The study wasn't followed along. We can't say that, the cohort that did this had less fractures at year 3, year 5, year 8. So again, as far as we can see that there was an improvement in bone mineral density, which one could sort of deduct may lead to more fractures, but we can't say so with absolute confirmation. The other thing is that the intervention group had the combination of heavy lifting with high impact. So we can't also sit and say heavy lifting does this or high impact does that. They were done as a combination. And so again, we can't from this study alone separate the two. Although I will say from other studies looking at improvement in bone mineral density, my educated thought or opinion, let's put it that, my educated opinion is that it was probably the resistance training that had the most power, because we do know when it comes to bone health, particularly in postmenopausal women, that resistance training has been shown to be more effective than impact, jump training, those kind of things alone. So, but again, from this study, looking at this study specifically, we can't separate the two and determine which was more effective or not. They came, as a couple.
Yeah. Super interesting findings. And I think, one of the things as a trainer that I would love to know is how many of these women kept going with their heavy lifts after they completed the study. And I'm going to guess that the women who came in had very little experience with sort of that lower rep range, your loads, higher resistance.
I don't know. I mean, there was no level, and they weren't, there was no inclusion or exclusion criteria based on their previous workouts. That's a great question though. But I will say that the women who sign up for these studies, you already have a motivated group, right? You've got women who are worried about their bone health, understandably so. They've already been told they have low bone mineral density, and they're willing to, again, commit to either exercise group, but really commit to this program to see what the results would show. So I would say we've got a motivated group, which I would hope would then lead to, again, consistency and sustainability beyond the trial, particularly if you're the women who've, you've been doing this for 8 months and your bone mineral density has improved by 3% in your spine. I mean, if that's not motivation to keep going, but we don't know. Like I said, there was no follow-up beyond that 8-month mark.
Yeah. And I'm just going to share, two bits of experience, particularly in the type of training that the higher resistance training did. And I've always found it's so cool, amongst the bone density findings, that's amazing because that's not something that most trainers or most programs have access to, right? Unless your client is going out and finding and doing those things on their own. But it's always a very empowering thing for women to really learn the ins and outs of strength training and training at, especially 5 reps, or 85% of your 1 rep max, because that's what they were doing for 5 sets of 5. Wicked benefits shown in this study, particularly on the bone density side. And as we talk about so much, all of the other different benefits that come with that. And then in terms of, they called it high magnitude strains at high rates. So the jumping type of exercises, I think there is definitely an importance and can be very beneficial, especially as we get older, to include this type of training, because ultimately it's as we get older, what's going to help keep us young. And there are many benefits to it amongst the bone density side, but also to just the other functionality side, which they tested. And I would love to read more and hear more about that within the study. And to the other side and the other group, like we see it so often, women who come to us, come to our programs. I mean, I've been doing this for the past 20 years of my career. So many women who are exercising and, doing a certain method or following a certain plan or program where, they might have 3-pound dumbbells, or they might have 5-pound dumbbells, or they might just do body weight. And it's always the difference that I talk about with a lot of our members, and I've talked about on the podcast before, the difference between just simply exercising and training and the different benefits that can come with that. And it's interesting in this study how they actually showed, they're still doing some sort of exercise, but they still saw a further reduction and decline in their bone mineral density.
Exactly, which is telling us, and I think this is also a really key important message that I want to make sure our listeners, appreciate as well, is that clearly if they were continuing to lose bone mass, whatever their gentle exercise program was at home, it wasn't challenging the muscles enough, right, to actually put the stimulus on the bone to continue to build. So what do I mean by that? I don't want anyone listening to this, either as a woman with low bone, as a woman who's worried about future low bone mineral density, or as a clinician who might be, relaying this message to their patients. This study did show that heavy lifting in a supervised environment was both safe and effective for women with low bone mineral density. It does not mean that you have to lift heavy in the 5 rep range in order to build bone. What you need to do to build bone, and we know this in the evidence and multiple studies show this, is you need to challenge your muscle and put enough force into the muscle and therefore onto the bone in order to stimulate both the growth of muscle and bone. So that can look at the 12 to 15 rep range. You could be lifting 10 pounds and by the 12 rep be exhausted, close to your, fatigue ability. As long as you challenge your muscles enough, then that is putting enough force on the bone to build. The issue is, like you said, we tend to get comfortable and, we tend to start picking up the 3 pounds, and 3 months later, we're still doing the same 12 sets with 3 pounds, when really to properly challenge and fatigue our muscles and put that necessary on basically force on our bone to build, we need to be building up over time. We need to be starting to pick up the 5 and then the 10 and then the 12 and then the 15 as we get stronger. So that's really the key message. And like I said, this study showed that it was safe and effective in a supervised environment for patients or women with low bone mass to be able to lift heavy in that 5 rep range. It doesn't say that you have to lift heavy. So I just want to be clear on that, because the messaging, particularly in social media and in the internet space, is very confusing. Like, oh my gosh, I have to be lifting heavy all the time. That's not right for everybody. Last thing, and I think you can agree, Jake, as a trainer, the last thing we want is somebody to go and throw themselves behind a barbell who hasn't been there before with low bone mass and start trying to get into that 5 rep range without supervision. That's not what we want. And it's what we love about what we do, because, we have women coming to us who, under the supervision of our trainers, get behind that barbell and start to lift heavy in a safe way. And some who even come to us because of the low bone mass. So I really like this study because, I felt good about obviously what we were doing I've always felt good. Our trainers, I'll be the first one to say, top notch, the safety of our clients are always at the top of their mind. But it was nice to hear the study that like the women that are coming to us because of concerns of osteoporosis or osteopenia, that again, we can challenge them in safe ways in supervised environments and really help their bone health.
Yeah, 100%. And, this study looked at one benefit specifically, and we know and we've seen time and time again that there are just so many other additional benefits that come with that. And for anyone listening to this who, is maybe saying, I'm worried about my bone density, I am doing home workouts, they're very light, I'm using the same weights. From my experience, my approach as a trainer was always to have a client come in. We always start with an initial assessment. That is a great or a great place to start. And we do have a resource called Strong Starts here, which walks you through how to do that. So you can just message us and we'll send it to you. Typically if I had someone who is brand new to strength training and their goal was, to get as strong as possible and to reap all of these benefits, there was usually at least a 3-month, but probably even more so, I would say, anywhere from 3 to 6 months before we progress them to ever using a barbell and ever doing lifts of 5 reps or less than 85% of their 1 rep max. And that is to make sure that they've built up enough tissue tolerance, built up really good confidence in the movement that they're doing, how they're executing the movement, that their form is really good before we transition them to, because 5 reps of your 1 rep max, so 85% of your 1 rep max for 5 reps is fairly advanced, I would say. So if you're listening to this, just know that, this doesn't have to be a tomorrow thing, and that you just want to, again, just slowly, steadily and build and increase. And I will also say that what's really cool, and we've seen this time and time again, I've been seeing this for the past 20 years of my career, but you mentioned it, like, you do want to progress to that next stage and that next step. It's going to look different for everyone, but that line of progression and that rate of progression will continue to increase. Our muscles and our bones are very adaptive. And so as we continue to put stress and strain, we want to increase. And we've had so many members we work with where they come to us with those 5, 10s or 15s. And then, it's not, okay, you need to go and get a squat rack tomorrow. It's okay, well, I need a bit more of a challenge, or their trainer or coach would say, we've kind of maxed out everything you have here. And the goal of this program is really to help you get as strong, as fit as possible. And so they'd go to the 10s and the 25s. And then a couple months later, it'd be, 30s and a 40. And then eventually they'd get to a point where it's like, okay, I feel like I've really maxed out with my dumbbells. And then they would progress to the squat rack and doing these 5 rep lifts and things like that. Definitely not something that has to happen overnight. But I think the big take home from this study is obviously you do really want to push and progress with your resistance training to get the benefits out of it. And
if you have low bone mineral density, it's not too late. Like, this is not something you should avoid. You can still approach it safely and, again, under supervision and reap the benefits. And that's the biggest thing for me, because for a long time in my practice, it was like, oh, you have osteoporosis, like sort of you've missed the boat on safe resistance training. And that's what this study really, to me, is not necessarily the case. So was super excited to be able to talk about it today. And hopefully our listeners, either as women themselves or clinicians, may be able to benefit from the information. As always, if you have any questions about the study or anything to do with that, please send me an email, Suzanne at thefitphysician.com. Happy to dig deeper into any of this if anyone wanted that information. We'll also put a link to the study in the show notes, as always.
Cool. Thank you so much for tuning in to another edition of the Fit Physician Podcast.